if we respond, so on and so forth, and so having this more casual chat where we can live stream Facebook, YouTube, and now working with LinkedIn, that's amazing because we can see what you're talking about. You can see each other's conversations as well, and we can answer your questions live versus having somebody in the background grab the questions and put them in. Plus, I think there is something fun about having that casual atmosphere. It's nice to kind of let your hair down, which we don't have our hair down. I was just commenting on my little fancy bun up here. And you can get a better feel for us as our personalities kind of probably come through when we're being casual, right? You want to get to know us a little bit better.
I really was contemplating staying in my t-shirt today and not putting makeup on and seeing how y'all like that.
I have to tell you that I didn't put anything on my face until, in fact, I had typed in an hour too early and said, I'm going to the little girl's room and I'm going to go put my face on. And Boyd had said, you got, it's like 2 hours. But oh, that's right. And so we don't, that's one of the perks of working from home. But a lot of our webinars are at night. So we don't put a face on until in the evening. And there's a few nights I looked really good and I wanted my husband to take me out afterwards. Like, hey, we can't waste this. How long it took to I hate to just go to bed.
Well, you can't see it behind me, but a lot of times I'm doing these. My husband's in bed sleeping. So,
yeah.
So, he sleeps with the light on. I turn it all off, but then I'm like, got to go take all my makeup off and go to bed when we're done. So.
Well, that's true. Talking about being casual, this is one of the nights doing these live and being more casual that we don't have to tell our kids to be as quiet, although we do. We've all three already been doing that. But we've had our service dog has come up and stuck his nose, or I know Jennifer's son was poking his head in a couple times and stuff. And
He's
what?
Not here right now.
Fun. So it's fun to kind of feel like you get to know us a little bit better on a personal level, right? To be able to do these and yet still answer your questions. But the other thing that being more content related, I think this gives people the opportunity where we give them the subject we're going to talk about. We'll talk about it, but we can do more sales pages stuff. What did you call that earlier, Boyd? When I said, oh, I don't want to have to show a sales page. What'd you say that was called? That
something marketing.
He had some
personal marketing fancy, or something. No,
yeah,
I don't know.
Yeah, some fancy marketing name. It's like, oh, okay, yeah. But if you guys content marketing, if you have a question about something about CCO or even behind the scenes, see, this is the time that you can ask it. Maybe you've had a question that you couldn't find an FAQ on the website or something, and this way you can bend our ear live, and it's just kind of fun. So. Oh yeah, we really could. Good idea.
Thanks, Boyd.
Yeah. That's why his job, right? So
he's not the clucking hen, huh?
No. He's the cat wrangler. We'll tell you that about some other time. So, really, pharmacology is extremely important as a medical coder. Now, I would say also other things. I'll mention that medical terminology and anatomy is extremely important. Jennifer, is there anything else you can think about just off the top of your head that benefits a person as a medical coder?
Other skills. I mean, of course, definitely the anatomy and but the you talk about it all the time, and I know that's anatomy and terminology, but that disease process is not just pharmacology, because that's dealing with a specific disease for specific reasons or something. But the that disease
pathophysiology.
Pathophysiology, knowing what's going to happen next or what could happen or where that extra little bit of knowledge that you're not a doctor, but you're reading that medical record, and if you can kind of put two and two together a little bit more, that would make for a good query instead
Yeah.
of just going, is this what you mean? And they'll be like, what are you talking about? No, that's not what I mean.
Right,
So
right.
yeah, that's understanding that, which I'm picking up as I go because I have not had a course in that. And right now I'm going to wait till
Mm.
I finish all of my courses before I do anything else. But
Yeah.
I've got a week break to write all my presentations right now. So yeah, so definitely that pathophysiology.
I agree. We actually have a course in that. We'll have to talk about that
Mhm.
maybe at one of these another time too. You know, I was just telling my daughter-in-law, I think yesterday, that she was asking some questions. She's a pharmacy tech, and she was having to renew her license and some other things, and she doesn't want to do what I do. She's not interested in coding per se, which just miffs me to no end that none of my children or anybody want to do what I do. But that she had asked me some questions, and I said, "Oh yeah, it's all about the disease process. Oh yeah, the and she will recognize the drugs and the things that I talk about. But I said some of the people that make the best medical coders are ones that have been sick in
Mhm.
their life, have had things wrong with them, or they've been a caregiver for somebody, because the disease process makes sense. You're familiar with the medications on a broader range of medications that somebody that may be a lay person, not in the medical field, has
Oh
never been
yeah.
exposed to, especially for people that have had cancer or been involved in being a caregiver for someone that has cancer, but some other things, even some autoimmune diseases and stuff. But even just being a parent and knowing the difference between the flu and a cold, right?
Mhm.
That they're actually very different, and the way they're treated is very different. You
Right.
can't really cure either one, and yet the medication that you give them different medications to treat the signs and symptoms, and the cold and the flu have different signs and symptoms. So again, just that little bit of knowledge of understanding the difference between Tylenol and ibuprofen, or Advil, is is a big deal, or even Benadryl and some other types
Mhm.
of medication. Knowing that Benadryl is diphenhydramine, because that's what it says on the grocery store shelf. You would maybe some people don't know, but again, that's probably one of the number one medications that you actually know the generic name, because you see it all the time, diphenhydramine. It's that pink stuff. And it really does. It makes it easier as a coder to abstract the information, and like Jennifer said, be able to think about
Mhm.
the disease process and project. One of the things that I have showed in the class, and since we just recently did a video on cerebral vascular accidents, strokes, CVAs, and TIAs, we did a Pearl here recently, is things like the medication TPA. Now, I could, it's like tryptophan, blah, blah, blah. I don't even know what TPA stands for. I mean, when I see it written out, I know what it is, but it's not something that I have to know, because everybody writes TPA. But it's a medication that's given to people who have stroke under certain circumstances. And when it came out, it was this miracle drug, because it it's actually a type of blood thinner. It busts up clots, is what it does. So people that were having a stroke due to a clot, a thrombus or an embolus, then it would bust this if they could give it to them within the first 4 hours of their signs and symptoms. But the key is, there's two different types of CVAs. There's an ischemic one that's a clot, but there's another one that's a brain
Mhm.
bleed. And there's two different codes for that. It's completely two different sections there, and it takes them a little while to do testing, determine which one it is. And then when they do, you can look at that medical record of the ER visit, and if you see that TPA is administered, you immediately know that was an ischemic stroke, not a hemorrhagic because they would bleed to death. And so that means that you know where to go and look in the codes, because it's 2 different codes that you use. And so little things like that, that you start learning the medication. That's probably one of the best examples. But I did pull this from our pharmacology course. Now, I can tell you that even though both of us, Jennifer and I, have done coding through the years and stuff like that, and she works a lot with orthopedics, and we all know that she's our billing specialist too. Some of these maybe medications in these areas that you might not be as familiar with unless you have been exposed to them. So with her background in bones, osteoporosis, right?
Yeah, I know those and narcotics.
Oh, yeah.
Those are really the only ones I know. Antibiotics,
Antibiotics.
because patients require antibiotics who've had total joint replacements
Mhm.
prior to having dental cleanings. So they have to be
Mm.
on an antibiotic course. Antibiotics, of course, for infections,
Yeah.
from wound injuries, finger injuries, things like that. And mainly our narcotics, of course, muscle relaxers. So pretty much
Mm.
anything, I don't even know if they use Celebrex anymore, but I guess it's now Naproxen. But
Yeah.
all the different just pain relievers, pretty much, because a lot of
Mhm.
times, even on the billing side, if we're trying to find an MRI authorization or CT authorization or something like that, patients have to have had courses of medication, either Tylenol even, or something, or some other kinds of injections, a lot of times before an insurance company is going to authorize an MRI or CT scan. They want to make sure they've done all of the non-surgical options prior. So we have to be able to look for those Tylenols, the ibuprofens, the naproxens, the same, all of those generic
Mhm.
over-the-counter drugs, pretty much, as the course of treatment. So a lot of times, you don't even think a Tylenol is important, so you don't write it down. It is
Mhm.
very important. It can be very important. That's a pain reliever.
Yeah.
Acetaminophen. Yeah, I know that one. So,
Acetaminophen. Yeah. And,
so it's a
well,
form of pain reliever. So in my
yeah.
case, that's very important.
Mhm.
So, a lot of people don't, oh, I take a Tylenol. That's nothing, it's no big deal. Well, it can be a very big deal, even something an over the counter, because it could also have a reaction to something else you're taking too.
That's what I was
Yep.
gonna mention. Yeah.
Yeah. Yeah,
And,
especially
uh
ibuprofens or things like that could have a reaction. My mother-in-law just had total shoulder replacement a week ago. So she's elderly, so you're supposed to be on the aspirin for the blood thinning. She needs to be on
Mhm.
6 weeks of aspirin, but she's also taking tramadol. So
Mm.
you can't have, and all the aspirins nowadays come with NSAIDs. So you can't
Yeah.
have an NSAID along with tramadol. So I talked to the pharmacist. I said, okay, what am I supposed to do then? So, she says, okay, just wait a couple hours and then take it. So you can't take them together because, it can cause problems. It can have
Pretty much.
reactions of just
Well,
upset stomach or other conditions, but you also shouldn't be taking multiple different pain types together. So, yeah.
right. And people think that over the counter it's safe, but it interacts with other
Mhm.
stuff. Just having a basic knowledge of the pharmacology and medications and interactions is really important, whether you're in the medical field or not, because say your mother-in-law had surgery like that, they might not have known to even
Mhm.
ask, and then it causes problems. I mean, I have had horror stories told to me about people that didn't tell their provider that they took St. John's wort because it's over the counter. Well, it's a massive blood thinner. And if you're on Coumadin therapy, people drop
Oh, yeah.
dead of bleeding out because they didn't say, because they're depressed because of their surgery. And that's why they take St. John's wort. But um, maybe in the layman's world, not in our world, uh, people think that Tylenol and ibuprofen is safe. Ibuprofen is also a blood thinner. And so, of course, it's not like St. John's wort, it's not like Coumadin and everything, but they will tell you if you're going to have a procedure done, even if it's just like a upper or lower GI, don't take ibuprofen before the procedure, because, you know, if they find anything and they want to take a polyp or something, you're more likely to bleed more, you know. But there's other reasons why. But you actually, Tylenol is much more dangerous for the body for an overdose than ibuprofen. And because ibuprofen will irritate a stomach, the stomach lining, and it you know, will thin your blood. But even if a person were to take too much of it accidentally, you know, even if you drink a bottle of ibuprofen pills for whatever reasons, you know, or you just take too many, that's going to tear your stomach up, but it's not going to kill you. And
Yeah.
well, you know, not they can stop that. But if you do the same thing with Tylenol, it destroys your liver, and your liver has to process that, and it will shut down your liver. You can go into liver failure with an overdose of Tylenol, you know, and that's an over-the-counter medication that people don't think of, and it ends up being dangerous because they think, well, you know, I can take 800 milligrams of ibuprofen, so I should be able to
Right.
take 800 milligrams of Tylenol, right? And it's like, no, that's like drinking I always tell my husband, it's like drinking a 12-ounce can of beer and a shot of whiskey. You know, no, you can't drink 12 ounces of whiskey and think that it's not going to, you know, not going to affect you. And so it's the little things like that, if you are in the medical field, that it's also your role to educate the people that you know, the patients. Now, if that's not your role, you know, you're
Right.
not an MA, a nurse or something like that, you're not tasked to do that. But if you are in the medical field, and let's say you're an MA or whatever, and you need to be able to articulate to the patient that I need to know everything that you take so that we can write this down for the provider to
Right.
see, even if it's over the counter, you know, how important that is.
Yeah. Jessica brought up, even vitamins. You
Oh,
know, everybody thinks it's healthy for me, vitamins or some of
yeah.
these health supplements that you can get from,
Mhm.
nutritionists or things like that. I mean, they
Yeah.
can still have a big impact because,
Yes, they
especially
can.
if you have an excess buildup of certain vitamins, that can cause problems as well.
Mhm.
Or, because what do they say? Like, I can't remember exactly how it goes, and so but like some medications don't let you absorb calcium or things like that. So there's certain
Yeah,
medications you shouldn't take along with your vitamins because
right.
they're blocking that absorption of that vitamin from even working. So the body's not even getting those nutrients
Mhm.
that you're trying to give it. So
There's a reason why people that are taking medications for their blood pressure and their heart, they would say their heart pill or something, can't um, eat or drink grapefruit,
mm,
because it literally stops the absorption into the system. So you're not getting the medication. And, you know, so therefore it's not working. And those medications might be for arrhythmias, you know, and that's dangerous.
mhm,
So again, you'll see this stuff in the documentation. Now, let's bring it all back to the coder. Why is it important? And when you look at some of these, Jennifer was telling you the medications that she's familiar with the the work that she does in orthopedics. And I know that with my background, with risk adjustment, I got to see a lot of these things. The thing that makes it unique with CDI and risk adjustment and auditors is it allows you to link a disease with a medication. So of course the common ones would be, you know, if a person was diabetic, we're going to look for, most likely they're going to be on a medication. Now, if they're on insulin, that immediately tells us that um, that their diabetes is either, oh, type 1 always has to have insulin no matter what, but you could be type 2 and have insulin, right? So if you see a medication that's on an oral um, uh, glycemic medication, then you know they're not a type 1 diabetic. It's just a given because they have to have insulin.
mhm,
Okay. And so that is something that you process as you're going through. Now, but you could be a type 2 and still be on insulin, right? Even sliding scales, so on and so forth. So, but what you can do is you've narrowed it down, right? Uh, uh, People who are on insulin pumps tend to be more type 1 diabetics because they're approved from the insurance. Or you could still be a type 2 and be on an insulin pump, but more likely you're a type 1. So it's little stuff like that you pick up. Respiratory medications, absolutely, because things risk adjust. So if you are on, it's one thing to be on an albuterol. That's a common, it's an emergency medication, that it's not a maintenance medication. So anybody that has allergies, asthma, anything, they will, albuterol is pretty common, you know. However, if they're on other types of medications, like, oh gosh, now I'm my brain just I've had to take some of them for a while. They tell you, no, this person's has COPD, because you wouldn't give this person the person this is a maintenance medication. They have to get up every morning, give themselves, you know, inhale some of this every morning and every night, or their lungs are not going to work properly. You know, so that's a giveaway on the disease process. Nervous system. I think of, I call it the Gabby pill, gabapentin or whatever it.
I can go get my mother-in-law's medication list.
Yeah, we can just go through the medication. I got this is what I take. I keep mine in so that if I travel, I know, or if I'm in another room and it's like, oh, I forgot to take my meds. I'll tell them, my kids are like, go get the pink bag. I need to take my meds. You know, nerve issues. That could be people that have diabetes, have nerve issues.
Yep.
People that have fibromyalgia can have this. Now, then think of a person who has pain in their extremities. Okay, let's say in their lower legs. If it's a nerve issue, they're going to be on a medication like gabapentin. But let's say it's not that. It's actually, oh gosh, why is my brain clicking out? The crystals. What am I thinking? You get in your feet, you know, gout. Okay.
Oh, yeah.
That
I'm thinking,
can,
I got crystals in my feet? What are you doing?
yeah. I've
yeah,
seen them
gout.
actually get those little pieces. It looks like glass. And so that could, the way the person describes it could sound just like the nerve pain, but when you look at the medication that they're on, no, they got gout, you know, completely different area. And so, and of course, pain medications. Wow, that reveals a lot. Antidepressants. Going back over, I probably know more about respiratory and circulatory medications if I looked at this list, because I like those areas. You know, maybe the antidepressants and the tranquilizers and stuff, because depression, now that we have mental health being paid by insurance, we definitely see more medications, don't we? Well, you know, well, think of a person that's gone in and fractured their hip, okay, and they're elderly, and they've got this whole list of medications. They're not going to be as mobile as they used to be and stuff like that. Sometimes they get depressed, and the provider addresses that, and there may be a time where they need to take some medication to help that with that. Diuretics. Wow, there's a lot of reason to take diuretics. It you know, anything that affects the urinary system, but if a person has any type of cirrhosis of the liver, their extremities are going to fill up with fluid, right? Anybody has CHF, their lower extremities are going to fill up with fluid. You know, if they have breathing problems, you know, if they're getting COPD and stuff, their extremities are going to fill up with fluid. So
wow, all those things you just said, I see why my mother-in-law takes a water pill now. Wow.
I got walking kidneys. Yeah, and then different water pills do different things. So what they give a person Lasix for is different than what they would give HCTZ for. Now, they're both diuretics, but they're a little bit different. And so if you see a person that's on Lasix, man, they're wanting to dump fluid really, really fast, right? And usually a person that has a cardiovascular type problem stuff, you see them on Lasix, and furosemide is the generic for that. But if you see someone like me that has HCTZ, that's kind of a long, drawn out, it's really old fashioned, but it's extremely harsh water pill. So if you see a person on HCTZ, you're definitely going to see that they take potassium too. And so again, you put all of these together. Why are they on, why are they taking potassium? Oh, because they're taking a water pill. And there's other reasons for people to take potassium. A lot of times when, if you look at the cancer medications, isn't that listed on here? I'm trying to see it.
I thought I saw it, but
It's not anti-parasitic. Anyway, well, if people that are going through cancer treatments and stuff, their body loses some of those nutrients, and sometimes they'll be put on things like vitamin D and potassium, because our heart's chemical, and if we don't keep those
need to keep the reactions going. Yeah.
or you have chest pains and stuff. Let's see. I have a son with RA, so drugs that affect the anatomic nervous system, as well as, I saw it on there too, autoimmune, any type of immunosuppressant, is important. Oh, there it is, right under immunizing agents and immunosuppressants and antineoplastic drugs. That's chemo for cancer.
Oh, there it is. Okay.
Yeah. And then right underneath that would be molecular and targeted therapies, which is medication that also work for cancer. And we're at that age where drug therapy for women, that specifically they're talking about menopause, but they're also,
there.
yeah. That also means if you're taking birth control pills, that's drug therapy. Older adults. Now, I automatically think of CMS, HCCs, and stuff like that. So with your older adults, there's almost like you almost see you turn 65, and these people start taking a standard thing of medications, just
without
standard.
the list. Yeah.
Aspirin. I don't know any 65-year-old person that isn't taking aspirin. Well, if they don't go to the doctor, then they don't take aspirin. But if they see the doctor, they automatically just take them. They take baby aspirin, and stuff. So
yeah, a lot of our doctors, even in orthopedics, if they get not necessarily elderly who's coming in because of a pathological fracture or anything like that, or a compression fracture, it's mainly because they come in to follow up for their osteoarthritis, or whatever condition they might have. They come in a couple times a year. They're recommending a lot of different vitamins or a lot of different these different drugs that they can just take to better their system, to better their bone health. A lot of these joint pills or things like that to increase their bone health, even not just their body, but and not even the osteoporosis, any of them, to keep the fractures down, but it's just the vitamin K or things like they want more beneficial health for the bones even.
Yeah, that my mother-in-law has severe osteoporosis, and she's kind of gone through the gamut of the different medications that you take for that. And luckily, there's so many that they're out there. The last one that she was taking was making her sick and making her ache really, really bad. And she told them she wasn't going to take it anymore. So they went back to what she'd taken before, which they didn't really like that, because she needs more, she needed what she was taking, but then it's quality of life too, right? So you have to think about that. Even I just noticed that I still have this here, my little B12 shot that I get at the pharmacy. I'll turn it around backwards so you don't see my label and everything. So this is I actually give myself my shot. So this is my B12 that comes in here. They give me a syringe, and I just stick myself with it. It's an intermuscular, so you stab straight down versus, and the reason I have to take that is because I had gastric surgery. Now, there's people, when you get to be a certain age with geriatric patients, their body just can't help produce those red blood cells. And so this B12 helps with that. So we see a lot of patients on B12. Mine is because of a nutritional deficit, but again, that happens with the elderly too, right? You don't eat as much as you get older, and but your body just wears out. Your digestive tract just doesn't absorb medication as much, or medication
Well,
or food like it used to.
yeah, a lot of the systems just start slowing down. They start to reach their peak. They just don't
Yes.
produce the same that they used to anymore. Whether it's the eyes, you get a lot of elderly people with cataracts and all the
Oh,
buildup and fluids, or the stomach or the lungs. You just think about it, they've worked an awful long time and
yeah.
they just don't produce as much anymore. And that's why it just, my mother-in-law, every time she just picks up a dish, she's like, and I was like, and a lot of times I go, are you okay? Do you need me to do
Yeah.
the dishes for you? She's like, no, why? I'm like, because it sounds like you're labored breathing and you're struggling doing it. She's like, oh, I sound like that all the time. And I'm like, okay, but it makes me worried
Yeah.
that
Yeah.
it's just what she does, the little aches and pains that they get just from moving,
Hmm.
and it just is difficult. Um, I don't know where we might introduce this, but Whitney had brought up documentation that she sees a lot that the elderly are not compliant with their medications.
Oh, yeah.
So, a lot of
Non-compliance
times.
doesn't just end with the elderly, though. I mean, there's a lot of people that aren't compliant.
Well, yeah, but a lot of times the elderly, they either forget or they're, things going on. They don't remember, they don't have somebody to help them or take them to the pharmacy, or their plan doesn't have a mail order prescription, or, a lot of things. A lot of times there's a lot of different reasons for non-compliance,
Money.
or I think money,
Can't afford to
definitely.
get it.
Yeah, I think my husband's more, I'm not going to be I'm not going to start taking these medicines because I don't want to be like my mom and having this list this long and all these pill boxes, and did I take them this morning? Did I take them?
Yeah.
And even though they got the Monday morning, Monday afternoon, Monday,
Hmm.
still
Yeah.
it can be overwhelming for a lot of people. And if you're like my mother-in-law, you don't get up till noon. Well, do you take your morning medication at noon then, or do you take, it? So maybe that could be a reason for non-compliance.
Mhm.
But that makes me think of another point. I'm sorry. Um, Looking at the medical records, we have listed all this medications, but that's a very important job for the scribe or tech or
Oh, yeah.
whoever is helping with the documentation. Are you still on these medications? Because you're in dealing with risk adjustment,
Oh,
you're looking at it going, oh, they have this disease, they have this process, but no, they took that 2 years ago
yeah.
and that's cleared up, and the things are fine now, or whatever the case may be.
Person's
That
been on penicillin for 6 months. Man, they're one sick puppy. Copied
Well,
and
yeah,
pasted.
and that comes very important for the coder, is
Mhm.
looking at all of that, all of those medical medications that they're on, and now you're starting to think of this diagnosis and that diagnosis, but the doctor didn't document it. So do they have it? Do they not? Do I skip it? Do I
Yeah.
code it? Do I, what do I do with it? Now, from
And you're better, the more you know about it makes it easier for you to query the provider properly if you understand the basics of pharmacology too, where you'll recognize a problem as the coder when you're going back, because a big part of what coders do is auditing and CDI work too. I mean, you just do. And especially if you're working with a provider that you're familiar with, and you'll see something, you'll think, I better ask the provider about that. Going back to compliance, we talked about the elderly people, geriatric age and stuff, but and men, it's not that men in general don't, but I don't think they particularly like taking medicine, but I remember how I struggled to use the inhalers, and I had my lungs were in pretty bad shape, uh, but because I had to take an inhaler every morning and every night, and it was maintenance medication, not the emergency, that but I treated it like, well, I feel like I can breathe. And when you go long enough, not breathing well, you forget what it feels like to be able to breathe well until you use your medication. And I more than once had the provider tell me I wasn't being compliant, that this was not a choice. And you know, I wasn't able to pass oh, the test, where they put you in the
The
room and plug
PFT
everything.
test.
Yeah,
Oh
I
yeah.
couldn't pass one
Yeah.
unless I used my inhaler before. And I remember the last time I had one done, and she asked me, she goes, "You're not passing." And she goes, "You're not going to be able to have surgery if, and I said, "Well, I use inhaler. Should I use it?" And she's like, "Yes." And I passed as soon as I used it, and it was that mentality because I was busy. You know how it's hard it is to remember to take, to use that in the morning and the evening and stuff. And so I think we have to think about that in non. That's a really, really good point, though, in non-compliance. Um, you can't code that a person's not being compliant unless the provider states it, though.
Right. Right.
Just a little tip
Yeah.
there, by the way. That makes me think of with diabetes. We always say, you can teach anything with diabetes, but when you used to have a code for diabetics that were um, what am I trying to say? Not compliant. It was not unstable. What is? Oh my gosh, my brain must be really tired. Uh, you know what I
I
mean?
don't, I don't even have
They're
an old ICD. I remember it's an ICD-9.
yeah.
I don't know if
When
it's
it
an ICD-10.
when a person no, they don't have it in 10. You
Yeah.
you code them with diabetes with hyperglycemia or hypoglycemia, but it's uncontrolled diabetes is what it is. And that's what it was. And
Not
you have to
controlled.
have that. Yeah, not
Yeah.
and it means not in control. It doesn't mean that the patient is not taking their insulin or not taking their medication or they're hiding Twinkies under their pillow. A lot of people think of it as compliance, and that's not what that means. It means that no matter what drug that they use or whatever treatment that they set for the patient, they can't maintain their blood sugars. And so again, you have to be very careful and understand those terms. And when you understand pharmacology, those type of terms make sense to you. I haven't been getting a lot of questions in YouTube, so I don't know if there's something wrong with the YouTube. But if you guys are watching on YouTube, usually you are hopping a lot more than that. So feel free to type in a question. Okay, it's not just me. Okay, good, good. Um, I thought of another example of the the medications when a person is taking them is with substance abuse. Did you see that on there?
Yeah.
The third
Yeah.
top.
Yep.
Yeah, there are medications that can be abused. Okay, which we all know pain control is kind of what we think. There's actually other medications that can be abused, but we have to understand when we code what is stated as abuse, and
Misuse, right? Use, abuse, and misuse.
no, it's not
I don't know.
misuse. It's if a person, it's falls into the addiction, so the mental health
Mm.
uh, uh, falls in there, and it's not easy to determine what's use and what's abuse, right? And this works with cigarettes too, but sometimes with the medications, are they in remission? Are they recovering? Even with alcoholism, what the provider states and the medication that's involved. So if you understand that a little bit about substance abuse, then the coding will be easier because it gets a little difficult sometimes when you're reading the way it's articulated in the documentation. You're thinking, wait, is this abuse or just use? Are they in remission? Are they, they've abused opiates, but they're not right now? Is it, because they're having therapy, or, it can be, it can be, it can be difficult. And so that's an area you want to bring your knowledge up. I remember years ago when you, they don't list the drugs in the ICD. They list the type of drug. So
Yes.
an opiate you have to know what the opiates are, right?
Mm-hmm.
You need to know what the anticonvulsants are. They just list them as opiate. Okay, well, what's the difference between an opiate and a tranquilizer? And you're thinking, what? Well, a tranquilizer, isn't that what they shoot animals with, right? That dart? No, So,
I did see
diazepam,
that on there, and that's the first thing I was.
the
It's on the
tranquilizers,
second list there. I'm like, tranquilizers? No, they don't mean that. They don't
yeah,
mean
but they are classified as
knock an
tranquilizers.
elephant out. But
Yeah.
yeah.
Valium, right?
Mhm.
That's a tranquilizer. Diazepam. No, is it diazepam? Diazepam
Don't
is
ask me.
diazepam is generic for Valium, I think. It's been a while. I can tell you, I truly, truly am so thankful that I spent so many years working in a pharmacy, because man, I used to be really good. And I can kind of remember stuff, but I haven't had to do it as much. So I,
Mhm.
sometimes, how you go like, what was that drug again? What was that again? Um, so
Oh, and there's so
again,
many of them coming out nowadays too,
oh
for
wow, yeah,
everything. Your eczema, your alopecia, all
yeah,
depressants, antidepressants, half
uh-huh.
depressants, whatever and there's so many of them out there, and the names are just don't make any
Hmm.
sense to me whatsoever. So,
So
I know there's a reason behind them, but yeah, and it must be very confusing. I wanted to bring up really quick use, abuse, and dependence.
dependence, that's what I was
Carrie,
trying to remember. Sorry.
Carrie reminded us that's dependence. Yep.
Thank you, Carrie. Yeah. Use disorder.
Yeah.
Loretta said use disorder. Yeah, that's right. And that
Yeah.
falls actually under behavioral mental health too. And so people that you will see more of that charted, one, because it's statistics and they're capturing the statistics of it, but people are seeking help, right?
Mm-hmm.
Because the insurance is helping now, whereas before they didn't. So that's good. And mental health is something that you really need to bring your knowledge up in as well. There's a big need for people coding in mental health. Uh,
And
Notice
Whitney
this.
said yes, diazepam is Valium.
Okay, I thought so, but I was like, they give. I'm trying to remember what they give. Ativan, I think is which is like diazepam, that they give my son when he has a seizure.
Yeah, yeah.
Yeah. And so we actually have a prescription and keep it on hand. We used to have to give it to him as a suppository, but because we can't inject them. And then they came out with about, gosh, it's maybe 10 years ago, 5 years ago. Um, they had it in England before they got it over here, but it's a nasal. So it's literally a syringe, and it has a nasal atomizer on the top of that you apply on the syringe. And if the insurance ordered that, it was like $100, but I found them online for like 5. So it's this little rubber stopper that actually makes it like a mist. And so we draw up how much he gets, and depending on how long his seizures last, then that's how we know. And then you literally go right up the nose, and it's that medication. So it'll stop the seizure, but once you administer that, you have to go to the ER. So it's kind of like, think of an EpiPen. You can have an EpiPen if you have an allergic reaction, but you're going to the
Uh-oh.
ER if you inject yourself. So, yeah.
Mhm.
Why did you say uh-oh? Did you say
I
uh-oh?
lost you for like
Oh,
2
oh,
minutes. Yeah,
okay. I was like,
I
oh.
lost you. And right as you came back, I said,
Okay.
"Uh-oh." I was like, "Uh-oh, what happened to her?"
We
And
we
actually,
already,
sometimes I don't know if it's actually my internet, and I
or
can't,
mine.
and I've frozen or you frozen. So I,
Yeah. The uh, we've already talked about over the counter, which herbal therapies and drug therapies, but we kind of skipped over we talked about older adults, but we didn't talk about children too.
Mhm.
I don't know if any of you guys are working in pediatrics, but having children that are on medication, and my sons, oh my gosh, we just went from moving one medication up to a higher dose to a lower dose and back and forth and so on and so forth. And so we have actual 2 pill planners for my son. And, you know, with children, especially when they get to that teenage years where they're growing and puberty kicks in and stuff and doses. So for some of the medication he's taking an adult dose, but that's because of his size, not his age. And then there's other
Right.
medications that his size would be relevant, but his age is more relevant as far as the dose is concerned. And so these are things that any understanding that you can't give a child an adult dose. And I think sometimes we think of adult doses. So when we think of an aspirin, or remember how dangerous a Tylenol was, you know, you can't be giving children uh, extra strength Tylenol, you know, like we would take 2 extra strength Tylenols. You can't do that to a child. Again, you're compromising their organs if you do. Uh, but just looking at the doses that you see for a child, looking at adults and seeing they're on taking child's aspirin. Why would they take child's aspirin? Because it's a low dose aspirin, and they do that to thin the blood. I'm trying to look up here. Probably voters, you know, you don't really need to know that as much. It's helpful to be aware of it, but I wouldn't say that that would be important. But administration of medications is extremely important. Now,
That is
remember,
one that we use. I
yeah,
mean,
absolutely.
definitely that's how we code those medications when we administer them.
Hmm.
Is, you know, we just had this last week in my work. My fellow coder called me and she's like, you know, for years, forever, when we coded, it was always 10 milligram injection. Well, somebody was reading a note and they're like, wait a minute, they're giving 40 and 60 now. And we have not been billing 40 or 60
Because it's
because
always been
nobody
10.
ever told us that they weren't doing, you know, they didn't indicate it, they don't mark it. And unfortunately, we prospective code. So, you know, we didn't know that. We didn't have the note.
Mhm.
So, yeah, unfortunately, that's a loss of money for businesses. So, you know, we've caught it
Right.
and now we have a way to correct it. But it, you know, forever it was a standard operating procedure, what we call in the government SOP, standard operating
Mhm.
procedure for how we do business. And somebody changed it at some point in time and didn't
It didn't.
notify the billers, the coders. So, but
Mhm.
that's how we bill everything. All of our J codes are
Mhm.
all dependent. That's where your math comes in, your
Mhm.
math skills. Yeah, the mathematics of drug dosage there is
Yep,
that top
that's
line,
right.
the second column. So, yeah, that's very important for coding.
And I detest math, I wanna tell you, but this type of math doesn't bother me because it makes sense to me. So don't freak out and think, "Oh my gosh, I gotta do math." Nah, it's not as bad. But you do have to be aware of how it's based in units and, you know,
Mhm.
you see equivalents and stuff like that that you won't see generally. Um, Oh, you know what? T just said, so as a medical coder and a medical biller, you need to know the name brand and the generic name of drugs.
Mhm.
How would you memorize them? Do you keep a list? Actually, there's this great website called drugs.com that I used when I was doing
Mhm.
risk adjustment. Now, honestly, most everything's written in generic name. Not all the time, but in documentation, especially now that things are electronic, um, the generic name is dropped down for people, and the nurses, the clinicians, and stuff, they'll pick the generic name because most people buy generics because they're cheaper, right? That doesn't mean it's always like that. And the patient may know the medication by its name brand. One of my son's medications, he's on triliptol, and but he doesn't take triliptol. He takes the generic. But the generic is this really long oxy. It's not oxycarbazine, but it's like that, and it's just like this long. And so I just say he's on triliptol, but he doesn't actually take triliptol. He takes the generic form, and but they know both of those. However, there's new drugs that he's on that haven't been out long enough. They're not on their drop down list, and
Or,
so. that
or in our coding books, because if they've been
that's
out for a
right.
certain amount of time, they need to be out, I think, what is it, 6 months by the FDA or something like that before they even make it into our
Yeah.
HCPCS books. And now HCPCS does distinguish between, you can look up
Yes.
a medication's name and it will tell you other names that are with it. So that
Hmm.
does make it a little bit easier when you're trying to
Right.
code something. They say I injected dexamethasone, and you're like, okay, wait a minute, what is that? Is that steroid? Is that this? Is that Celestone? Is that, you're trying to look at the names. They will list them in the HCPCS as to
Right.
the multiple names that they have. So.
When you do that introduction to pharmacology, one of the things that they talk about is things that have the endings in drugs tell you what they are. So something that ends in zone, is going to be more of a anti-inflammatory steroidy type medication, like amoxicillin. Anything that ends in illin is
And
going to be an antibiotic, and so you learn those, but that really behooves you to learn that type of thing, because it makes you faster. You may not know what the drug is, but if you can take out the suffix and you're like, okay, I think this is a whatever. um, so that's important. You're never going to have them all memorized, but the more you're exposed to them, the better it goes. You can go to drugs.com. I use that all the time, but you can get apps for your phone now too. That's really helpful. Of course, I
and
didn't.
I
I
think
didn't
it's drugs.com, I think, is the website I used to use, because in coding, if it's not in your program, if you have to do one of these new codes,
Mhm.
you need the NDC number as well to
That's
include with
right.
that. So NDC is an 11-digit number, which couldn't be any variations divided by dashes and hyphens. So
Yeah.
it could be 2, 3, or 4 in the beginning, and then it breaks it down, and you have to put zeros in certain places, and so it makes it easy to, when you're putting a new code in your system, you need to include the NDC number, because
So
that's what labels that to the insurance company.
it is just like when you get a book and you want to order a book off Amazon, and you go plug
Looking
in.
up for the ISBN
Every
number.
single drug has one, and it's and the generic has a different than
Mhm.
the brand name, and different brands of generics will have different numbers too. It's all very individualized, and so that's something you learn working in pharmacology. That's very helpful. So we talked about the doses and stuff like that, but um, you know, I think we've covered just about everything kind of on here, why it is important. One thing that we haven't covered yet is we've talked about injections and we talked a lot about oral medications, but IV medications is something that you're going to see, especially if you're dealing with ER or inpatient, with inpatient coding. And of course, you've got the HICS picks. You're not going to find uh, oral medication in a HCPCS manual. They only do injections for IVs. Okay, and so that's important to be aware of that. And we know that if you're a Medicare patient, you're going to be using those HCPCS codes for those medications, and they're going to be in that manual. So again, knowing what type of medication it is, the verbiage, maybe even if you don't know how it's spelled, if you can get close, you're going to be able to find it in the HCPCS, and then you'll use those. I remember I had a flashback. My dad saying, "Well, I don't know." I tell my dad, "I don't know how to spell this word," and he's going to go look it up in the dictionary. It's like, but I can't spell it, so you can't look it up in the dictionary. Same thing with drugs. If you can get close, you can probably find it. But nowadays we have the computer, so you can just say, "What was that medication that's used to make you lose water in your extremities?" And they'll say it's a diuretic, and these are the.
Yeah.
So, so being aware of IV medications, and with coding, the difference between infusions and pushes and so on and so forth, that can be complicating enough, even if you're not if you're familiar with the medication, then you'll know, well, this is a medication they push, that it isn't a medication that's given to a patient over a long period of time, or this is a medication that has to be given out over a specific amount of time because that's the protocol for it, or it'll shut the kidneys down, or it'll do this, or it'll do that. And so again, if you're doing inpatient, you're going to want to be familiar with those, and that's all covered in this type of a course.
Do you recall off the top of your head if we have injection and infusion webinars already? I know I've done standard injection, but know about infusions, like a specific whole.
Our last Q&A, I did a thing on infusion because there was a specific infusion. I know we've had lots of questions about it via the club, the CCO club, if you guys want to go in and look at that. But which just made me think of spinal injections, because a question came in about that, which is medication going into the spine, which is, we haven't even covered that. But
sorry.
Yeah.
But yeah, Whitney was asking if we've done a webinar on injections and infusions. And
we have in the past. If you go to the YouTube channel, you could just type in infusion or type in injection. I remember Laureen did some in the past, so these may be maybe even 5 years, 6 years ago, but the information is still pertinent, even if the code might have changed a little bit. It's the concept is the same, and we're due to have another one. We
I know I did injections about a year ago. Within the past year, but I haven't done one specifically on infusions, just because they are very involved. Like you were talking about at the Q&A last week, you got to have your hierarchy. It depends if you're inpatient or outpatient. There's different, I'm sorry, facility or provider. So yeah, there's a lot of different guidelines and standards that you have to follow in order to bill them. So
you almost would have to do a whole hour on it, and then you wouldn't cover it all. Probably not. But it is an area that's difficult, that's confusing. But I have to say that once you get it, there isn't much change. It looks intimidating, but once you do it again and again and again. Now, I'm not saying I'm particularly good at it. I've just been exposed to it. So somebody that deals with doing coding out for chemotherapy, that's infusions and pushes at the same time, and they usually get pushes 3 times, and they get 2 different infusions, and and then you do that maybe every day for a week, every month, and then or they coming in every 4 weeks, and the medications change. A lot of people don't realize that for chemo, they actually do not mix up the meds until you come in, that they're going to do in the IVs. Versus if you're in the hospital, they'll just go, hey, go get some potassium, chloride. Okay. And they just go grab a bag. It's not like that. There is a pharmacist on staff that mixes it up per the doctor's orders that day when you walk in. And so that's, can you imagine coding for that? That would be exciting. So that's adeneoplastic drugs. We're getting really close. I think we're right there on our hour. Anything you want to wrap us up with, or any comments?
No, I was telling Alicia beforehand, I was like, okay, what's our topic? And she told me, and I was like, yeah, I don't know very, I need to learn more about that. So
I'm fascinated.
It is definitely something. Yeah, everybody has their strengths. And, I noticed, Whitney, she does a lot of different kind of coding, but I think she does ER coding. So yeah, you get a lot of all different kinds of areas. So, when you are specialized like I am, or, people in a certain field, it helps a lot to be able to branch out and learn something new, because you never know, you might like something else and it might be very interesting, and you'll just, I always love to just keep learning more. So that's why I like the forums and stuff, because we can go on and we got to do some more research and try and answer your questions. So
That's true, you guys. So this is all based on our pharmacology course that we have, and we have a pathophysiology course. These are all ancillary courses, so you're not going to get a certification for it, medical terminology and anatomy. But these are all courses that they don't cost very much. If you want to bring up your skill set, or you just need a refresher, go check them out. You can go to the CCO.us uh, site and then just look at courses. Now, uh, I website drugs.com, definitely, you know, definitely be on, have one of those. Take some time to nose around in your HCPCS manual if you haven't for a long time, or get on your encoder and pay attention to some of the HCPCS codes, and stuff. But Jennifer was right. There's new drugs coming out all the time. Now, if you want us to talk about something specific, let us know. Send us in a topic request, uh, and that's real easy to do at the cco.us website. But you know, even put it in the chat at the on Facebook and YouTube, because that's how we know that we're giving you content that you really need. We, like Boyd said, we can sit here and convince about it. As Lorraine said, we can talk about anything for an hour. But we want to give you stuff that's valuable to you, and it's all free. So let us know what you need help in, and we'll do some research or pick our little brains. And remember, Jennifer, orthopedics and billing is her specialty, which she actually knows a whole lot more than that. But I think that's what you like. Billing she loves
That's
to
what
do.
my main job has been. So yeah,
Yes.
yeah, that's where I have the most experience.
Yeah. And I like risk adjustment. So anything ICD or disease process really, really fascinates me. But hey, we've done it all. So
And I like the stories that Alicia tells about her family. That's my.
Which, my son Gary had a seizure again the other day in a pool. That's the second time in the when we ended up going to the ER because it was a little bit different seizure, and normally we don't. And anyway, the doctor looked at me and he said, "You know that people with epilepsy can't swim or drive." And I said, "Well, first of all, thank you very much for mentioning the driving in front of him, because he's 15 years old and he's pretty upset about that. So thanks, and I said it like that. And I said, but let me ask you, is the swimming because it's not very bright because you could drown, or is it because it brings on a seizure?" He said, "Well, because you could drown." I said, "Yeah, okay, that's what I thought." It's like, yeah, you have to give up the swimming too. But anyway, he was a nice guy.
Yeah. Great. So thank you, everybody. And I guess we will see you next time, next week.
I'm having a baby tomorrow at 5 o'clock in the morning.
She's
by the way,
not. Somebody in the family is.
Seventh grandbaby, my seventh grandbaby baby. So next time I see you, I'll be a grandma again, guys. I'll let you know all about it.
Safe travels and safe delivery for your daughter.
Thank you.
All right. See you guys.
Yeah. Bye.